I'm looking at the pictures now, and it's a tough little nose here. She's got a lot of features that are appear. I mean, like we could see the hump here. This kind of knob here is something we want to kind of smooth this in, lower this hump. Her nostril here is pretty big. Not much I can do about that. Usually we like to see this to be half of this, so that is what it is. I can't really do much with this. And then, so you can appreciate the sort of the size overall here of the nose, and so we're going to reduce some of the burden of the size here. You could definitely appreciate the width here. Look how crooked that is, and that's not an easy thing to correct. So you could never really make a perfectly straight nose, but you can see that this is her septum here, which is deviated to the right side, and then the rest of the nose here is going to the left, and this is all conoided here. So we got our work cut out for us, probably internal work and external work, to try to deal with everything. And the reason why I'm here is that this has to be realistic. I can't make a perfect nose here, but we can make it a lot better. And that's what we're going to strive to do, and that's what Lacey's going to try to pick up. So she wants to video the nose, right?
Mm-hmm. We didn't even have to talk her into it.
I mean, she's all over this video. All right, so tell the world what you want with that nose.
I want it to fix that, the deviated septum.
Okay, so the first thing I showed Lacey in there is like, okay, check out this. Show everyone. Go back so you can see how crooked that is. See that? See that septum is way crooked, way over here. That's probably the hardest part of this whole procedure, not the outside of her nose. Okay, so we're gonna have to help that. What else are we helping?
Like a slope more and
more
narrow.
Slope, narrow.
Yeah.
So the width of the nose.
Yeah, just more narrow. I don't want that, like the.
Yeah, the mass. The mass, right?
Yeah.
This whole thing here?
Yes.
Okay. You got bones over here, and you got some crookedness. The tip says this. She's got a lot of little things going on, but she just wants a smaller nose for sure and make it cuter, right? Okay. Now, to know Dr. C is to know that everybody knows I do a lot of these. Everybody knows I'm pretty good at what I do, but I'm not perfect. Everybody knows I've been doing this for 30 years, but I never tell people what they want to hear. So the first things I tell you is I tell everyone is I'll make it as good as I can make it. And then, what's the term that the other nurse told us? You like what you get, you don't throw a fit?
Yes, yeah. You get what you get.
You get what you get and you don't throw a fit.
Don't throw a fit.
And that would be perfectly straight. It's going to be remarkably different. And remember what you had so that you appreciate every day what we do today, okay?
All right.
And you do that, you're going to be a happy camper. If you're going to be the person that's in the mirror that's always, this is imperfect. I mean, look at his nose right now. Hey, we're going to make this thing 1,000 times better than it is, and it's like so super exciting. So, I mean, in all fairness, she just wants a nose that's more feminine. This is just like what do you call it?
It takes away from her natural beauty, I think.
I mean, look at these brows,
just distracting.
Look at those beautiful eyes, these cheeks, and these smiles, these lips.
Yeah.
This nose just basically takes too much away from her. And even I'll admit that. And I believe in beauty. Beauty is all over the place. But we want to tone that nose down and make this better, right? Okay, so
let's do it.
So we're on the same page. So tell me the breathing now. Which is worse, the right or the left?
I don't know. It depends on the day.
Do you have allergies?
Yes.
But that's a good thing that she said. It's funny. It depends on the day. So the moral of the story is that even though I can look and see one side is much more broken or much more deviated or much more obstructed than the other, you'd think that the side where everything's kind of blocked would be the worst side, but doesn't always work that way. And sometimes it goes to side, which is like, okay, it's on my left one day, the right to my day. So at the end of the day, who knows? But I'm going to do my best to kind of straighten up the plumbing on there and make this as cool as it gets. I'm excited. Are you excited?
I'm excited.
All right, so this is the internal work, which is not the fun part for the video because this is all on the inside of the nose and you simply can't see. But I can tell you in her particular nose, this is the hard part. And which is the irony of it all, because it's the part you don't see. But the reason why you all need to understand what this is all about is because this is about making sure that you can breathe. It's pretty important. And although I have some patients who probably say, oh, I don't care about breathing, doc, just make my nose look pretty. You gotta have to achieve both possible, pretty nose and good breathing, because you gotta be able to breathe. So it's a tricky part. It could be more challenging, and that's why we're going to do this in her. This is the columella in this region right here, and it's shifted to this side. This is the septum. I have half of it elevated right here. This is the soft tissue covering. This part is the cartilage in here. You see this, all this? So I'm all freed up on one side, and I'm going to get freed up on the other. And knife more. Yes. And then I'm going to decide what to do with this septum. There's like a million alternatives, which is why you don't try this at home. It's really what to do. In her particular case, that's why I always try to stress to everybody, every nose is a little bit different. Alright, hold this over if you can here, and I'll show you how I try to elevate the, so the if you could see this sponge in there more. This is the septum, this is the cartilage. This can be crooked, everyone has a crooked septum. If you go to an ear, nose, and throat doctor, everybody has a crooked septum because that's what they operate on, so that's got to be broken, I guess. So the idea of the nose here is that no one has a straight septum. It's just whether or not it causes problem. We see 1,000 people every day who had their septum corrected and they still can't breathe, or they didn't notice any difference, but insurance paid for it, blah blah blah. But anyway, don't get me going with all this stuff. In her particular case, I'm trying to mobilize the distal part of the septum here so that we can possibly consider straightening it out. So here I am doing my best to delicately expose the cartilages. This is the hard part of, well, it's all hard, I guess, but trying to expose these cartilages is going to be a little challenge because she's stuck here. But we're getting there. The white stuff is the cartilage. These are the tip cartilages. And you're watching it happen, I guess. So we'll see the shape of her nose and how it's reflected in the shape of these cartilages, because these cartilages here shape up the tip, and the rest of the nose is shaped up by the bone and the cartilage of the upper part of the nose. So we'll see those differences. So the only cartilage part is this early part here, right here, and then she goes right into bone, right? So I'm going to just separate these for a minute. Show me further down here. All right. Okay, so I'm going to segmentally take down some of this cartilage here. And I'm going to take it only down to the point of the bone, because she's got a lot of bone here. Alright, so we took that down. Okay, let go of that. See what that did. And so I just took down a little bit of the cartilage towards the tip area, right over here. But she's got a lot of bone. All this is bone. So now we're going to take this bone down in a good way, but not in a crazy way. We got to take it in a good way. We may actually want a little chisel because she's got a big old bone. So Mark, give me the chisel, the biggest one you got. This is not something you see me use often, but this is going to be a chisel. So the chisel is this device here. We're going to come across the dorsum and just take this bone down as instead of rasping it, we're going to take it down with this chisel. And it's just because she's so big. Okay. I don't think that's the way to go. I think this is the way to go. Tap, tap. Okay, tap, tap. Good. All right. Give me another one. Good. Another one. Nice. Go. Okay. Go. Alright, go. 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 A little bit better. Come on. Go. 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 Oh yeah, baby. Go. Oh nice. Go. Go. Good. Go here. Nice. Alright, you want to grab that piece? So let me grab this piece. So this was part of the bony dorsum here. It's always stuck because it's stuck. Alright, so, but here you go. Alright, so this part, I'll leave it, was right here, right? And I remove this, and you can see how that flattened that out, right? So that goes up, and now it's down, right? Because that piece was right here. And I'm going to rasp too, but this is just would have taken a while to rasp. So, but that's, you can see this is all bone. Rasp works on the bone, not the cartilage. Taking it down. Slowly and carefully. Gotta work with what I got here. So I still got more. This is cartilage in the middle here. Gotta take this down more. This is bone over here. Okay, so let's get more aggressive. So we're getting some upper cartilage here. Again, these are just another area of cartilage, and she's just got some really tough stuff. That's why she has what she has. Got some big bones. She got big cartilages. So we're going to work carefully to do our best. This fracture is going to give us a lot, which will be the good part too. Again, betterer, which is nice. Like this fracture is going to be a huge addition, but we got to get this down to a point where we like it. This is pretty straight now, but we got to be more aggressive. All right, let's get the rasp in there.
Yes.
No, I'm cooking with gas. It's a heavier rasp, so this will be more aggressive. Taking this bone down.
Filing it.
Can you hear that?
Yeah.
Can you? Oh, I can hear it. So this part is millimeter at a time. A lot of people say just shave my hump while you watch it. This is what shaving the hump is, okay? Contouring the dorsum. And this is hard. I'm working. I'm sweating. Not exactly, but you get the idea. So you seeing that change there a little bit?
Yeah.
Yeah, okay. So we're getting there. We're getting somewhere. You can see the tip is higher now than the dorsum, but the dorsum is still pretty high, so I gotta get more aggressive here. Looks like the nose just drops straight from the forehead. Doesn't have that nice little dip. So this will give us a little bit of better definition.
Yes.
Okay, now we're working on the tip area. So these stitches that I'm putting in are to get us better definition of the tip. Her cartilages are not particularly overgrown, or she doesn't really have a lot of problem with the cartilages per se. I think on frontal view I'm trying to narrow the nose, so really I'm trying to bring these dome segments a little bit closer. And so I'm also thinking and deciding whether or not I need a strut here for the columella, but I'm thinking not. So if she's picking this up, this flare right here, I'm going to control with a stitch that I'm going to put right there. See that? I think that would be pretty nice. Just to bring these tips a little closer. She's got pretty thick skin. I want to keep the tip still kind of nice and defined. I don't want it to just be a sort of a, just a single ball if possible. I want it to have some nice tip defining points. Sometimes it's very challenging to get the details out of the nose that you could see in a natural nose. But for people who never had that, getting closer to that point is always kind of cool. And so what I'll do is I throw a surgeon's knot here, and then I'll gently pull this together, and you can appreciate what's going on. You see that? That's pretty nice right there. I like that. So I'm going to just cinch it to that point, no more. And then I can take a look at what this did. If I don't like it, take it out. I'm not so sure I need the cartilage graft, but we'll see. And like I said, these lateral parts here, I may trim a little bit. Let's just take a look. I think I'm going to get most of the narrowing of the whole nose from the bones. Bones are going to carry everything in this nose. Okay, so yeah, so see how the tip is smaller right here? This is where the tip is. This is way out over here because this is where her nasal bones are. And you're going to see a big change once I do that fracture. And then this tip has got pretty good support. So now I'm just checking out the relationship between the tip and the dorsum. That looks pretty good. These nasal bones are still a tad high over here on both sides. So I'm going to rest that without trying to interfere with what I did here on the tip. Cartilage seems low enough. Okay, rest. Mark, give me the medium one more.
Yes.
Okay, so here's the fracture. We're side here, and I got my finger on the bone here, and we're gonna do an osteotomy. Go. think I've loosened these bones up adequately. Now I'm going to do this sort of fracture thing here. All right, so ready? Ooh. Oh, whoa. Look at that.
Wow.
Look at that.
Look at that. Ladies and that's swollen, ladies and gentlemen.
She's gonna go with that.
Mm-hmm.
I'd be
Totally
happy with
different.
that.
With that.
Look
Wow.
from this view here.
From that.
Coming down the pike. Oh, yeah, you get to see that too, yeah. That's pretty nice. Okay, so that's a good start. So we're kind of getting a recap of what's going on and where we are. All right, so nose is 1,000 times better. This is looking like a pretty normal nose. I have a nice tip set off here. Dorsum's much smaller, much wider, much less wide. In fact, it's remarkably less wide, which is the huge thing here. And I'm just dealing with these bones right now and trying to keep them aligned. And so I like everything. I like the shape. I like the stability. I have to preserve the breathing. And then look down over here in this angle over here if you can, right? So this is the problem I'm going to focus in on right now. Now that everything's pretty stable, I got this septum over here, okay, that's hello, you know, and I have to straighten that out. So that's what I'm going to focus in on now. So really what I'm trying to reveal to you, and it's, you got to use your imagination a little bit here. This is the nasal septum here, and I'm following it down to the nasal spine, which is a bone down in this region here. And I'm trying to free this up carefully just to get an idea. I don't want to completely go nuts because I want to suture this. But I do have to sort of flip this over if possible to the other side. I'm going to try to loosen it if I can from its home so I could shift it on the other side. They tend to bleed in here. Okay, so here we are. After you've seen that picture, you can see the septum is now pretty much in the midline. This is nice and straight. These nostrils are far more equal. I can trust me, folks, this will never be 100% perfect, but this is a game changer, okay? So don't expect perfection, but expect what you see right now, which is pretty impressive. All right, folks, so this has been a bit of a journey. You've probably seen what I would call pretty much an epic video, if I do say so myself. And it's because it was just unusual in a lot of ways, and so let's just kind of review what we've done. All right, so she's got these splints in, and her nose is a lot wider than it will be when those splints are out and when we're done. But the nose it's at least a third of the width that it was. So the dorsum's down. She's got a nice tip here. This is going to be narrow like that. That splint is opening up everything. And if you could see from this bird's eye view that the tip has a better shape, and we got that septum in the midline, so she no longer has that funk that you saw in this bottom angle. And I think everything went according to plan, and I'm super happy for her, and I hope this video sort of illustrates the possibilities.
So we're looking at her bruising here. So she has more bruising on this side, probably because maybe she laid on this side. You never know. It could just be just because there's more bruise. But we also are looking at the bruising in her eye itself. That is normal. It happens. It's a little shocking when you first see that. So I always want to let people know that is okay. It's nothing to be alarmed about. What else can you add about the last 7 days?
I don't know. I've just been in bed all week.
Yeah, your mom's taking care of you?
Yeah, my mom's taking care of me, and it hasn't hurt as much as I thought it would.
Okay, good.
It just kind of feels like I have something on my nose pretty
Yeah.
much, like up here.
Can you see it? Is it annoying?
Yeah, I can see it, but I think my eyes got used to it.
Good, good. And then did you have any problems like with not getting it wet or anything like that?
No, not
It's easy
really.
to shower.
I took
wet?
baths and I just didn't get my face wet.
Well, good. And your hair looks so pretty. Those stereo strips are on there. You okay?
Yeah, it's like a band-aid.
It is like a band-aid. I'm so sorry. I never want to hurt anybody, but okay. Let's look at you. Wow. It's so pretty. Okay, I'm going to slide in over here. And then, are we still going back?
We're going.
Okay.
Oh my gosh.
So this is the before. Oh, this, y'all.
Oh my
This is-
goodness.
okay, lay your head back.
Okay, can you put
Can you
the
see it?
mirror
Can you
down
put the
just a
mirror
little
down?
bit?
Let
She's like, but
everybody
I can't see. Oh,
see.
all right.
That is
Wow.
impressive.
Wow, that's so cool.
Yeah,
Here
that
we
is-
are. We're gonna remove these splints, and our splints are a little bit different than the typical ones. I mean, I actually don't use splints. The things that you see on my noses are these little telfa pads, and they usually come out in a day or two. In her case, she had a lot of curves going on, head up in the septum in there. So I actually use these splints to help like secure things during the healing period, so that I can do my best to keep these things aligned. Because what happens is cartilage has memory, and it kind of wants to go back to what it was. And so a lot of what I'm going to do is to try to keep it from having that memory. And so you can see this little plastic piece here, and we're going to just pull that out. Woohoo! Yeah. That's big. And I'm sure that feels like a relief, huh?
Yeah.
And this actually makes your nose appear wider as well, because these things
Are pushing out?
Yeah, they're pushing. You can see how it actually narrowed her nose already, but she's swollen, obviously. And we'll get this one out of here.
Mm-hmm.
Oh boy.
Good.
So we got
Good
that
job.
one.
Yay.
So look at that. It's much straighter than we had it, and we just got to keep it that way now. That's really the key. And we're going to tell her a lot of little things that she needs to do to make this
Home
a
run.
home run, as they say.
So exciting.
Okay, so we're going to clean her up too. What I can see here is that she's got a nice dorsum here, much less wide. She was super wide. She got a nice little tip going down over here. So this is mega swollen today. See this in 2 weeks, it's just going to be absolutely phenomenal. So that's the thing about noses, is what you see the week later when you're swollen and stuff. Oftentimes it's super swollen. Usually it's not as swollen as it was before we did the surgery, in terms of like it's always still smaller, but there's just a lot of water in there that tends to persist for a pretty long time. The initial swelling is mostly 6 weeks or so, and then the long term is about 2 years, believe it or not. But it's during this period of time that we're going to start to see some of the more finer details. And what I can tell you already is that this is impressive. And wow, look how straight that bottom is here. So I think we've achieved a lot of what we want. I think this is going to make her super duper happy. And it's just nice to know too that it's kind of the gift that keeps giving in terms of the swelling and stuff. So that's all good news. So right now we're going to clean her up, and then we're going to teach her how to tape her nose. Was it cool? Was it good for you? You're just excited, right?